Dr. Stewart at Timonium Foot and Ankle Center. I have my patient Michael here. Michael, thanks for joining us.
Thanks for being here.
Thank you. So Michael's got a really cool case. Michael has very, very high arch feet. He also has a little neuropathy. And if we come on over here, I want to show you this left foot. This left foot, he has these really, he has had a history of really bad calluses here and here. And actually, these are very mild because about 2.5 years ago, we introduced Radiesse dermal filler, which we're going to put on his left foot today. But before we put the Radiesse dermal filler, I wanted Michael to kind of share his experience because Michael came to me. You've been dealing with chronic foot pain, correct?
Correct. I've had chronic foot pain for 50 years prior to that. And I had been told I had one option, that was major surgery. And the odds of the major surgery being successful was not that good. That I would still have pain after the surgery. So it was never a very good option. I have had orthotics since the 70s, since 1974. And the orthotics has gotten better over the years, but it still did not help, especially with the left foot. The left foot always felt like I was walking on broken glass.
And he had really, really, really bad calluses. I mean, I remember when I first saw you, I had shaved these calluses, and it was actually kind of, I felt a little like I was torturing you because you kept pulling your foot away. We talked about a great option for you. We talked about a dermal filler. He basically, on his left foot, I mean, he had, if this is his skin, this is his bone, he had skin on bone, and he was really walking on his bones. And you told me you could barely walk, correct? You could barely stand.
Correct. It was painful to do anything. It was worse if I didn't have the shoes on, because with shoes I had support to some degree. And I always had, like I said, I always had the orthotics, and they helped to a degree. But I still cannot stand for any period of time. I couldn't walk very well. I became more and more sedentary, and the more sedentary I became, the fatter I became, and the heavier I became, the worse the pain was.
So we decided on dermal filler, and you told me you were very skeptical in the beginning.
Correct, because like I said, it had been 50 years, and I tried a number of different things over those 50 years, and nothing worked.
So I want to share that I tell patients dermal fillers on average, in my experience, last about 18 months before they need to be repeated. Michael is, in a good way, an outlier on this left foot. We did his first and only shots on the left foot in September of 2023. He's probably getting to the point where we're starting to contemplate repeating it, but his right foot's always been a source of conversation that we want to address, and we're finally going to address this foot today because it's getting to the point where it's really bothering him. But I mean, just share your outcomes. I will share that he's lost a tremendous amount of weight. He comes to see me regularly just for foot checks. He's much more active, and you told me you're able to kind of live your life now.
Correct, and I can walk 30 minutes now, 2.5 miles in 30 minutes that I was doing regularly. I had to stop recently, but not because of my feet, but rather my right knee. As you see, my right foot turns in somewhat, and it puts added pressure on the outside of my knee. So I've had to stop the walking for exercise, but I can still stand and walk without pain to my feet, which is a real...
It's giving you your life back.
Correct. I can do exercises, I can go to the gym, I can do yoga, which has helped with my flexibility. There are a number of things that I can do now that I wasn't able to do 3 years ago.
Perfect. Well, let's follow me over here because we've already numbed you up, and we're gonna just put right in here. We're gonna put the dermal filler. So we're gonna inject. We've already numbed him up. We're gonna inject in here. You might feel a little pressure, a little poke, And we're going to inject under the skin, and we're going to inject right between the skin and the bone. And I'm kind of coming and I'm going to feel this to make sure that it's going in the spot that I want. And I'm going to do this in what we call clockwise fashion. And this is 1.5 cc's of Radiesse. I'm going to come over here a little bit more. We're going to give a little another poke. Okay, and we're kind of going not too fast, not too slow. And you can see the skin whitening up because the Radiesse is a white color. And I always describe this as a toothpaste-like substance. And I'm putting it in, and you know, he has no pain, pretty easy. And we are done with that. So the injection's done. I'm going to put a pad around here, and I'm going to have Michael take some of these home. I used to keep people in boots and keep them off their foot, but the truth of the matter is that it was overkill. So I'm just going to put an offloading pad right here. Okay, Michael's going to go home with these. He should not have much pain. The whole idea of this pad is to keep the filler in place. The filler acts as a scaffold for the body to fill in what we call fibrosis or fibrotic tissue to help scar the area. And, you know, the idea is to reduce the pain. If he does not wear the aperture pad, it will spread off, and we just wasted a whole vial of Radiesse, and the result's not going to be what we want. I'll see Michael back in a week. I don't anticipate him to have a lot of pain. If he has any pain, I'll take a little Tylenol. He'll take it easy this week, and we'll share his follow-up when the time is right. Michael, thank you, and appreciate you sharing your story and letting us show your procedure today.
Thank you.
All right.